Hey, gals and guys, this is Christopher, and I'm an alcoholic. And this time out, I wanted to talk about obviously alcoholism, and I also wanted to talk about depression in terms of is it curable? Does it go away once you're an alcoholic? Are you always an alcoholic? Once you're a depressant, are you always a depressant? So I was always under the assumption or the thought process to the effect first when I started drinking and got into extreme drinking, as far as alcohol being a disease, I didn't really subscribe to that until later after I started going to counseling and therapy and sessions and everything and learned a lot more. And then I did come to the thinking that, okay, yeah, this is a brain disease and it's a gradual one. As you drink, are you genetically opposed? Not opposed. What am I trying to think of? Is it genetics? Do you have a genetic disposition? Maybe that's what I'm trying to think of. Towards it, I don't know. Is it something you learn if you're around? Is it a learned thing? I don't know. I've talked before that my dad drank, my grandfather drank, but I didn't drink until I was 21, and I always saw my dad drink, and I always thought that I was never going to do that. But I did predisposed. Predisposed. That's what the word I was trying to think of. Um, so I don't think it's a learned thing. At least, I mean, I guess it could be if you're around it all the time. I think a lot of things can be, just not alcoholism, right? I mean, abuse. If you abuse someone, if you abuse a wife or a girlfriend, that could be a learned thing that maybe your parent did the same thing, and that's not that that's an excuse towards anything, and nor is alcoholism, but I think those things can be learned. In my case, I don't believe my alcoholism is learned, and I don't abuse anybody, so that's not learned. Um, so so I don't know. I don't know. So I guess my point is, so I was talking to my counselor this past week on Wednesday, and she's the first one that actually said this, and this is my thinking moving forward. And so when I went to counseling and therapy the first time, my thinking was always, okay, well, a cancer patient is not always a cancer patient, right? If they get cured of cancer, they're not a cancer patient anymore. They don't have cancer anymore. So my thinking was the same with alcoholism. Okay, so I graduated from counseling in group, and you get a certificate and everything. At least in my case, and my thinking was, okay, once you're an alcoholic, you're not always an alcoholic. I mean, once you're a cancer victim and you're cured, you're not always a cancer victim. Once you're an alcoholic and you're cured, you're not always an alcoholic. I don't think that way anymore. Um, I did rebound. Obviously, I'm back in therapy. I've been sober since I believe September 1st. So it's been a month. It's been a solid month. Which yay on me. So let's keep that going. Do I think about it? Absolutely. Um, but I also lost a person that I really care about and love. So that's a big reason why I don't go back. And I'm also unemployed, which is another big reason because I have major anxiety for both. And I have to get a job. And maybe if I grow and I show that I'm not going to go back to a bottle and I have something to contribute in the form of employment, perhaps her and I shall get back together. And that's a possibility. We talk. We're not on bad terms or anything. She has kids and she just doesn't want her kids, obviously, around a situation of alcohol. Very different. They live out in a rural community, which is rural communities don't mean anything. I mean, obviously, there's alcoholics and drug users out in rural communities, but her kids have never been around it. Very protective around that. So, and my life is very different than that. I have been around it pretty much my whole life. So it's understandable that she doesn't want me around her kids if I'm going to have an issue, a problem, right? If there's a chance that I'm going to be drinking, because that's how we split up in the first place, is to the fact that I was watching her house and she came home at on Sunday earlier than I thought, and there was all these bottles in this tote, and her kids saw them, right? And I was drunk on her bed, and that's not cool. So that's the reason for that. But that's not really the reason for this conversation. The reason for this conversation is once you're an alcoholic, you're always an alcoholic. So I was talking to my counselor and I explained this whole thing about depression and alcoholism because I went to counseling for just depression that had nothing to do with alcohol, had nothing to do with my addiction, and had to do with my depression. And I felt like nothing was ever being solved. I went for a couple months, and sure, I would go and talk to the counselor, and I didn't mind talking to the counselor, but nothing was ever solved. And that's how I feel. That's how I feel now. I'm going to go back to counseling to see how that works. But she goes, "Yeah, okay, so you're a cancer victim, but you're not necessarily cured. You're in remission. So if you're an alcoholic and you're not drinking, um, you're not necessarily not an alcoholic. You're in remission." And I subscribe to that more now. I think, and don't let this depress you or detract you from getting better. I do believe once you're an alcoholic, it does not go away. You think about booze, and like 2.5 years when I was sober, I went and I picked up a drink and I drank and I kept going. We just can't stop. If you're a true alcoholic, I don't want to speak for everybody. In my case, if I start drinking, I don't stop. I'll go for a few days until it's like I'm not feeling, all that great, or I feel guilty, or whatever the case may be. I will stop eventually, but I'm not the kind of person that can sit down and have a drink or two. I'm not like my girlfriend, or my ex girlfriend, or whatever the case may be. She can sit down and have a glass of wine and be fine. You want to, as alcoholics, we want to do that. We want to go out and have a couple drinks and talk and have a good time. We're incapable of that. It might work the first time. We might be able to go out a couple drinks, pat ourselves on the back, and say, "Oh, that's awesome." And then a day or two later, three or four, and a day or two later, have five or six, and so on and so forth. So if you're an alcoholic, you know what I'm talking about. We can't do that. We can't drink like normal people. We can't drink at all. So I'm under the thinking now that once you're an alcoholic, you're always an alcoholic, and there's no cure for depression because I've had it since I was a kid. I've talked to people about it. I'm on drugs for it. And nothing's ever worked. The drugs help. So I don't want it to detract you. I don't want it to deter you. And I don't want it to depress you any further just because you're always going to have it. It's how you deal with it. You can cope with it. Um, and I brought the reason I'm have my screen up is I was going to talk about Twitch. If you know Twitch, he was on So You Think You Can Dance a long time ago. I used to watch it with my ex-wife, and also he was the DJ on the Ellen DeGeneres show. And he knew the guy was depressed, right? He killed himself last December, I do believe. Has it been a year already? So he killed himself because he was depressant. Um, I don't know his level of depression. I don't know your level of depression. It's different, obviously, for so many people. I think obviously suicide is it should be out of the question. I know you want to not be depressed anymore. I've been so depressed at times I just couldn't do anything. But you get over it. You deal with it, and unfortunately, I'm not him, so I can't say what he was going through. I can probably relate to it in some manner, but not totally. I'm not you. I'm not him, so I can't relate to it completely. Same with this other guy from General Hospital, this Billy Miller. He just killed himself just recently, the past month. Um, Bipolar. I'm not bipolar. Complete depressant, killed himself. So that's extreme. I don't want anyone to be doing that. You can deal with it. I don't know. Were they not taking prescription? Were they not seeing anyone? I don't know their story, to how they were dealing with it. So I want to talk to you. Okay, so I'm under the impression, or I'm under the thinking that okay, you're an alcoholic for the rest of your life. You're probably a depressant for the rest of your life. Okay, so I have those truths. Now I have to deal with it. It's just like anything, like diabetes. If you have diabetes, you probably have it for the rest of your life, depending, right? Um, various, I don't know, HIV. I'm trying to think of other things. I mean, AIDS is not as bad as it was in the 80s and the 90s. There's drugs that that can alleviate that. So that's my point. So I take Solidopram. I started at 10. I'm at 20 now, just because my depression is very huge. So it helps. It doesn't take the depression away. It it helps you cope with it. I take naltrexone. If you know what naltrexone, it's a like an inhibitor, so you don't crave alcohol. Does it work? Kind of. I still crave, even on it. There's shots you can get too. They're like $3,000 a shot or something ridiculous. I used to get them, and I didn't pay for it. My insurance paid for it, but there were shots that would last for a month, or you can take a pill each day. So I'm taking the pill each day, and then there's bupropion. So that's for anxiety, and helps because I've been off this stuff and I've had massive, major anxiety to the level I couldn't do anything. So this stuff helps, right? It doesn't cure it; it helps. So I'm under the understanding or under the thinking that, okay, I'm going to have this the rest of my life. Okay, I have to cope with it. This is the situation that life has given you. Now you have to cope with it. Suicide is, to me, out of the question for anybody. Um, I don't know. I don't want to say it's an easy out. Again, I'm not those people, so I don't know what they were going through. But I'd hate to think that's the final solution. I'd like to think that there are ways to cope. Um, and you have to get up in the morning. Sure, you're depressed. Sure, you have anxiety. You have to fight through it. People fight through. People are in wheelchairs, right? People have one leg, one arm. That's how they live. That's how they're going to be. Some people have no legs. Some people have no arms, right? But they live and they get through it and they cope. So that's really the point of this video, is to, okay, so this isn't going away. I'm always going to be an alcoholic, even though I don't drink. Um, I'm always going to be depressed on some level. I'm always going to have anxiety on some level. So cope. So we have to cope. We have to learn coping skills. Go find some help. If you don't know how to cope with it, find someone who can help you cope with it. Get hobbies. I do YouTube. I have 4 YouTube channels now. I get up in the morning and that's what I do. I need to find a job. I really do, because that will help me. That will fill my day. It'll get my mind off things where I get anxiety over and I get depression over, and then it will give me time away from thinking about alcohol. So that's a whole combination of things. So hopefully that will come up soon. And just don't sit and think. Don't lay on your bed. I know it's hard. I know it's really hard, but make sure you reach out to a medical professional, your doctor, and see what they can do for you. Medication, it's easy to throw a pill at something. I understand that. Get some exercise. If you're not into pills, go out and do something. Get up, fight through it. You have to. You don't have a choice. Don't. Suicide ain't an option. Ain't an option for me, and it ain't an option for you. You're gonna have to cope with it. All right. Put on your big girl pants or your big boy pants, or whatever the case may be. If you're 18 or older. If you're a kid, then obviously reach out to your parents or reach out to someone. Hopefully you have someone to reach out to. Reach out to me if you have to, and I'll find you some help. So that's the point of this blab fest, I guess, this time out. I just wanted to talk about that, and to the fact that it's not going away. I've come to the conclusion that it's not going away. It's always going to be there. It's always going to be looming over me. So that might be your case as well. I don't want to speak for you, but I don't think alcoholism goes away. I don't think you're a true alcoholic if it just goes away. I could be incorrect, and you tell me down in the comments if I am. I think depression does not go away. You can be depressed. There's people that are depressed, have fits of depression. Everyone gets depressed. Mine is a constant. It doesn't go away. My anxiety is a constant. It doesn't go away. I'm just not depressed for a couple days, and then I'm all the Fruit Loops and Cheerios. That's what a depressant is, right? It's a constant. It's not you're depressed for a couple days. That's your normal human being is. We are chronically depressed, so we have to deal. We have to. And you tell me down in the description, how do you deal with it? What do you do? What are your hobbies? Tell me some information about you and how you deal with it. And hopefully, if this channel ever grows at all, someone will come along and see those comments, and maybe something will click in their brain. All right, gals and guys, that's what I basically wanted to get through. That's what I've been gambling about this time out. If you could please subscribe to the channel, I'd appreciate it. There's not many views yet. There's not many videos on here, and I'll make a video as I want to talk about something, and as I have time to make them. All right, so subscribe, like, share, especially with people who are having a problem, and hit the bell for updates. And I think that's the list that you're supposed to say at the end of every YouTube video. That's what every YouTuber usually says. All right, gals and guys, comments down in the description. Reach out if you need help. I'll do the best I can for you. There's links on the YouTube channel for places you can link to and get help. There's plenty of help out there. You got to reach out. You know, I tell people all the time, you can't help someone if they don't want help. You know, and you know that, and most people understand that. All right, I've talked enough. I'll talk to you later.